my name is Dr. Justine from the Justine Blainey Wellness Center, and today we're going to talk about whiplash. That can happen in a car accident. Most of the time we're thinking we're driving and our head goes forward and backwards, or even if you get hit from the side, right? You're driving along and your head get from side to side. So we think about having a car accident, but it also can happen if you fall backwards, your head does a whiplash. It can fall playing a sport, right? When you get hit from the side or into the boards. It can happen in any type of sport where you just go really quickly with that part of your neck. Now there's different levels of whiplash associated disorder. That's called a WAD, whiplash associated disorder. If you have a WAD 1, then it's normally pain around the muscles of your neck. That's going to affect your scalenes, these front muscles of your neck, if they get stretched and pushed back. And these scalenes can affect the brachial plexus, the nerves that exit your neck and then come down your arm from this part. And you can get numbness and tingling if that's damaged enough, and that will bring you to a WAD 2, whiplash associated 2. And that nerve interference from this top part of your neck can affect into your hand in 3 different ways. It might affect your radial nerve, your median nerve, or your ulnar nerve, C6, C7, C8. So we have different patterns because there's 7 cervical bones in your neck that can be affected, and 8 cervical nerves that will affect down your arm. So a WAD 1 is more of the tension of the muscles, and then WAD 2 can affect the nerves that come down, and WAD 3 would be that much worse. So we're worried about those scalenes on the front of your neck, but on the back, right at the top here, we're gonna worry about those suboccipitals. That means just below your occiput, your head, the levator scap, the posterior deep cervical muscles, as well as your traps. And that can lead to a lot of tension in the back of the neck where you just want to hold your head like this. And sometimes you might get things like headaches, dizziness, vertigo, ringing in your ears, troubles with your eyes, troubles with your ears, into your arms, or that numbness or tingling or weakness in your hand, because we know that that brain stem is affected. That's why as chiropractors, we want to take a look at x-rays after a car accident or after a whiplash from a sport or a trauma like a fall or work injury. We want to look at this normal C curve in the neck. Normally it should be 45 degrees. Highly recommend that everybody knows their baseline, because you never know when that trauma is going to happen to you, and you don't know what normal is for you versus after the trauma. So I believe everybody should have a baseline spinal checkup, just the way you get your blood pressure checked, your teeth checked, your eyes checked. Everybody should know their baseline. These nerves in the top part of your neck, they go to your head. And if there's a problem here, it can affect all the way down. We even have a nerve right at the top here that can be called the vagus nerve. It's the wandering nerve, this blue one. And it can travel to your heart, so it can affect heart racing. It can affect into your lungs, make you breathe faster. It even comes all the way down to your digestion. So super important to look at your neck after having a trauma like that. And there's a couple of different things that you can do to help, along with chiropractic care, that can be as gentle as a feather or deep work, depending on what your size, your age, the trauma that you've had. Along with our massage therapy, physiotherapy, and acupuncture. These are all great therapies for after having a whiplash. Some of the exercises you can do are stretches. So going to your side, going to your opposite side, coming down, turning from one side to the other. These are called active stretches. You can add it passively by adding a little more pressure with your hand in either side. And you want to, with the rotation, you can also add just a little extra pressure or have somebody help you. Stretches should be to comfort to about 60%, and you want to hold those stretches. At the beginning, it might only be 10 seconds, and then longer as you get better. I do want to review with you isometrics. That's how you can get these muscles engaged and stronger after having a trauma like this, in order to get those muscles starting to engage and hold this heavy head with all those brains up. So isometrics means you're contracting the muscle, but you're not moving. So in this example, I'm going to try and push my head to the right. You'll see these muscles engage, but I'm not moving. So I'm engaging these muscles, and then I could do the same thing, engaging my left side muscles. And then for those front muscles, I can push forward. And for those back muscles, I can push backwards. And the same thing can be done for rotation. So I'm resisting rotation to the right. You'll feel it here. And then a resisting rotation here. And again, you'll do it to comfort. You may start with 5 seconds, working your way up to 10 or 15 seconds. We want to be able to help you for these nerves to function better. We have an exam team who will help you with specific exercises and spinal rehab and equipment to help you maintain this cervical curve, and preferably before an accident, because we know that if you have a better curve, if you do have a trauma, you're going to respond better. If you have questions about whiplash, WOD, we're here to help you. We have an amazing team, so contact us at the Justine Blainey Wellness Center, and we'd love to do what we call a meet and greet, an opportunity to answer questions or a consultation. So stay tuned with us. Always lots more information on all of our amazing wellness talks. We have an amazing team of massage, acupuncture, physiotherapy, naturopaths, holistic nutrition, and chiropractors, and we're here to help you and your family.